Hi, I'm Dr. Ramya Valiveru. I'm an endocrine and breast surgeon and oncologist practicing with KIMS Hospitals, Hyderabad. In this video, let us understand what do we mean by nodules in the thyroid gland and who developed this and how do we deal with this kind of diseases. So first of all, thyroid is a butterfly shaped gland which is located in the front of the neck. It can get affected with various diseases. The most common being hypothyroidism, meaning the gland doesn't function well and produces less amount of hormones. This is one of the very common diseases and seen in about 5 to 10% of the population, especially amongst women. But even men can develop this disease. But there is something called as thyroid nodules. Means the gland develops certain growths or overgrowths within the gland, which can be either single or multiple. So the reason for development of nodules are many. It could be because of iodine deficiency, iodine excess, environmental factors, radiation, mutations or familial causes. So in a given individual, it is often difficult to determine what is the reason for development of these nodules. So the patients can come to us with either a swelling which is visible in the front of the neck, either they notice it or their family members or friends might notice it and tell them that, see, you have a swelling which is moving up and down when you are swallowing or talking. That is often the case when the patients come to us with that complaint. When the size is very big, the patients can also come to us with difficulty in breathing, recent onset snoring, difficulty in swallowing, or rarely a voice change also. But in this day and age, because of routine performance of imaging for various problems, we are seeing something called as thyroid incidentally detected nodules. That means the patient is not aware that there is any nodule in the thyroid, but some other test for some other reason has shown nodules in the thyroid. So whenever a patient comes to us with either that or this problem, we then do a thorough clinical history examination and perform something called as an ultrasound scan of the thyroid. We give a score to every nodule, which is called as TIRADS scoring, which is a standard everywhere in the world. And with this score, we have information whether it could be a benign, that is non-cancerous nodule, or a cancerous nodule. We then may choose to perform something called as a fine needle aspiration cytology. In the common terms, it is called as FNAC. We pick up some cells from those nodules under ultrasound guidance and look at them in the microscope, and we are usually able to tell whether it is a cancer nodule or a benign nodule. So not everybody who has nodules need surgery. So only the ones who have large nodules or the ones which are causing symptoms or discomfort for the patient or the ones that are looking suspicious for cancer are the only ones that need surgery. So it's been seen that if we randomly pick up 100 individuals, male or female, about 40-50 years of age, and we perform ultrasound scan, about 50 to 60 individuals may have some sort of a nodule. We are not going to operate or evaluate everyone. So we are going to choose the ones that are suspicious or large in size. So knowledge is power. Be aware of the thyroid nodules. Thank you.